Healthcare workers across Philadelphia have been getting vaccinated for COVID-19 as part of Phase 1A.
But there's confusion over screening and how to get the second dose. A dental hygienist reached out to NBC10 Responds when she says she couldn't get an appointment for her second dose.
In dental, that's a profession that the people you're working on don't wear masks.
Because she's not affiliated with the health system, Inga Cateman says she signed up for her first dose through Philadelphia's online portal set up by the city to get healthcare workers vaccinated at local Rite Aid pharmacies.
It was smooth sailing. I signed up. I registered online, gave some information. I booked an appointment, no problem. I went to my appointment. That was no problem. I got the vaccine.
Inga says that was on January 15th. She got the Moderna vaccine, meaning her second dose is due in 28 days.
They said you need to go set up your next appointment online like you did the original. But when I went back online, there's just it just says no doses, no appointments. I don't know if there's no doses, there's just no appointments anywhere within a 50-mile radius.
Based on that, Inga fears people are jumping the line ahead of licensed healthcare workers.
There's no policing. When you go, you just show your driver's license and your health insurance card. And the pharmacist even said, he's like, we know certain people aren't in healthcare. He's like, but we're not supposed to police anyone. We can't ask for ID. So, I mean, any healthcare proof.
Inga contacted the city and got an email from the city health department. It reads in part, "We've been working with Rite Aid to try to straighten out their appointment system. They have not been able to limit who they are accepting, including persons who live outside Philadelphia." We reached out to Rite Aid about screening people and the line jumping issue. They told us in part it does not determine or participate in the state or local jurisdiction's credentialing or eligibility checking process. And went on to say, our team is working incredibly hard to do all we can to support our states and jurisdiction partners in Phase 1, while at the same time doing all we can to educate customers on when they may be available for the vaccine. We asked the city about the issue.
We're working with Rite Aid on the procedures and asking them to follow the standards for who's in the priority group.
As doctor said, that this is being looked at, and if they're not going to follow our guidelines, they're probably not going to be involved in the program.
Regarding Inga's second dose and what healthcare workers getting their vaccine through Rite Aid should know, the company says in part, if for any reason a customer didn't schedule a second appointment at the time of the first vaccination, their pharmacist will reach out to schedule a second appointment. After NBC10 Responds contacted Rite Aid about Inga's situation, she received a call by a pharmacist who scheduled her second dose. She rolls up her sleeve February 12th.
I feel very relieved and I have peace of mind, and I just wanted to say thank you to you and for NBC10 Responds for helping look into this.
And again, Rite Aid says after the first dose, a pharmacist will follow up with a reminder call closer to the second dose date to assure their second vaccination is received on time. Now, since speaking with the city on Tuesday about what happened with Inga, we got this statement about changes in the city's contract with Rite Aid. It says the pharmacy will stress to their pharmacists that they check for residency and healthcare provider status. The city has agreed that Rite Aid would change the priority groups that they're focusing on to help facilitate verification. And after it finishes already scheduled appointments with unaffiliated healthcare workers, Rite Aid will only set new appointments for Philadelphians 75 years old and up. That should start in February. We reached out to Rite Aid about that change. It has not responded.